Hello everyone, I'm going to talk to you today about forensic risk assessment. As you all know, forensic risk assessments are tools used by a range of professionals in the criminal justice system. These assessments are important as they can determine an offender's likelihood of reoffending in the future and can identify which individuals need an intervention. Forensic risk assessments play a major role in decision making at various stages of the criminal justice system, such as sentencing and preventative detention orders. Therefore, as you can imagine, it is important that forensic risk assessments are valid and accurate in the calculations they make. To illustrate, an underestimation of risk may result in public safety issues, where a high-risk offender is released into the community and does not receive adequate interventions to reduce their likelihood of offending. Alternatively, an overestimation will result in violations of individual liberties, where a low-risk offender is unnecessarily incarcerated or placed into intensive treatment programs that actually increase their offending risk. This presentation will first review the literature for the best type of forensic assessment, then evaluate the usefulness of forensic risk assessments as a whole, and outline some ethical issues surrounding risk assessments. Throughout this presentation, it will become clear that we must have high standards for the accuracy of forensic risk assessments, and that current evidence is not satisfying that standard. Over 400 forensic risk assessments exist and can be categorized into three main types of assessment. Unstructured clinical judgment utilizes the skills of the professional and their experience of the offender alone to reach a decision. This is beneficial as it allows the assessment to incorporate a wide variety of case-specific factors that may influence their recidivism, such as their motivation for the crime. Although research has shown that professionals, such as criminal psychologists, using unstructured clinical judgment cannot predict the likelihood of violent reoffending above the level of chance. Additionally, because this method relies on the judgment of the clinician, it is highly subjective and vulnerable to human biases, and consequently has poor reliability and predictability. Therefore, I recommend that this method of risk assessment should not be used in our practice. Actuarial assessments remove clinical judgment entirely and choose to focus on factors that are statistically associated with offending behavior. This method is useful as factors are able to be weighted to the amount of variance it causes in offending behavior. This assessment produces a score that is derived from the rates of recidivism from similar offenders possessing the same risk factors. Therefore, this method is objective, quick to administer, and typically transparent in how the score is derived. Although this method has been criticized for its inability to incorporate case-specific information, while it is possible to modify the assessment to include case-specific factors, this has been found to actually weaken the reliability and predictability of actuarial assessments. Structured clinical judgment is a method that was designed to address this inflexibility of actuarial assessments. Professionals, such as clinical psychologists, decide if a person presents as low, medium, or high risk based on a series of questions about risk factors, in addition to the clinician's professional judgment of the offender from the interview. This method has been praised for its ability to integrate case-specific information and its treatment of the offender as an individual, not the sum of particular risk factors. Although this method has been criticized for taking much longer to administer and still being highly subjective. This is because structured clinical judgment possesses unregulated amounts of clinical discretion and low inter-rater reliability. Additionally, the design of low, medium, and high risk categories have not been standardized, and there is no clear distinction between each category. Therefore, it is possible that two individuals with the exact same risk factors will be identified as low or medium based on how the assessor interprets the importance of the risk factors for the overall case. Moreover, the low, medium, and high risk categories have not been actually correlated with the real risk of offending. To demonstrate, a high-risk classification from the HCR20, a structured clinical judgment tool, was found to be associated with violence rates ranging from 5 to 100%. Even actuarial assessments with defined categories of risk, such as the VRAG, are poorly calibrated to demonstrate a score of 14 is associated with a range of 7 to 75% of violence risk in the following year. Moreover, it has been found that more than half of individuals judged by tools as high risk are incorrectly classified and will not go on to offend, and 9% of those classified as low risk will go on to offend. Therefore, an allocation to a particular risk category does not seem to tell us much about the actual risk of offending. Current evidence suggests that structured clinical judgment and actuarial assessment are far superior in their validity and reliability than clinical judgment alone. As such, clinical judgment is now rarely used in practice. Additionally, both structured clinical judgments and actuarial assessment, despite their differences, have both produced roughly equivalent predictive abilities for future offending. Most research conducted in this area focused on one or a few tools' ability to predict recidivism, and some received great results. Although, when this information is collated into systematic reviews, consistently, no one tool stands out as predicting more accurately than others, and assessment's validity tends to widely vary among individual studies. A recent systematic review by Faisal Law 2022 of 11 commonly used forensic risk assessment tools found that the tools had mixed performance, ranging from poor to moderate predictive ability. This paper assessed some of the most widely previously validated tools currently used in forensic risk assessment, such as the Static 99 and HCR 20. Previous meta-analysis comparing commonly used risk assessments have found similar results in the moderate range. Faisal et al. Argue this discrepancy between good and bad findings is due to an overestimation of predictive ability in studies with small sample sizes, in addition to authorship bias, where individuals who develop the tools typically find better performance of their tool. Damaris and Singh, 2013, reviewed risk assessments in the United States and found that a third of studies were conducted by the author of the tool itself. In fact, authors find their tool to have predictive ability 2 times greater than non-authors. Additionally, the creator being an author in the paper is rarely disclosed as a conflict of interest. Furthermore, many studies do not present the full picture of predictive accuracy and only use correlation and effect sizes to find the tool reliable and valid. Research must incorporate measures of discrimination to accurately measure the ability of risk assessments. Risk assessments are commonly conducted in court proceedings, where both the prosecution and defense will produce a risk assessment for the same offender. Psychologists and other professionals conducting the risk assessments should be unbiased and present an accurate judgment of risk, despite the motivations of the side that hired them. Although Murray et al. 2009 discovered that scores between opposing evaluators in court proceedings were greater than reported in the test manual and were in the direction that supported the side that hired them. Therefore, allegiance to the prosecution or defense may bias risk assessments. Few validation studies of forensic risk assessment tools have been conducted on minority populations. In fact, validation studies have overwhelmingly been conducted on white participants. This is a problem because minority groups are heavily overrepresented in the justice system. An Australian study found that 3 of the most popular tools for assessing youth were unable to predict recidivism at levels greater than TANCE for culturally and linguistically diverse youth in custody. In fact, an international meta-analysis discovered that the validity of forensic risk assessments reduces as samples become more ethnically diverse. Therefore, risk assessments are failing to predict recidivism accurately for minority populations. As risk assessments are particularly poor when conducted on diverse populations, under the APS Code 8.1, we should inform the client that the assessment has many limitations and may not be accurate when we are assessing an ethnically and culturally diverse offender. It is also important we work within our area of competence, outlined in the APS Code B.1.2. As there are countless different forensic risk assessment tools designed for a variety of offenders and offences, we must make sure we have received adequate training in a particular tool before we decide to use it. Because the client is a professional in the justice system, not the offender themselves, we cannot obtain informed consent and maintain confidentiality as the offender may wish. Although forensic risk assessments are considered exceptions to the usual requirements of consent and confidentiality, it is still important to inform the client of the purpose of the assessment and explain how the information is collected, stored, and who the information will be shared with. Criminal psychologists assessing offenders that have committed serious crimes may experience anger, fear, or disgust when assessing them. Although the APS Codes of Ethics 8.2.1 outlines that psychologists must show respect for their client, they have moral rights and should not denigrate their character. This may be particularly difficult to do, even with the most experienced clinicians, when faced with particularly shocking crimes. Forensic risk assessments are tools used to make major decisions for the offender. If these decisions are incorrect, they have significant impacts on the offender themselves, as well as the general public. This presentation has demonstrated that although there is some evidence supporting the usefulness of forensic risk assessments, there are serious concerns about the quality of this evidence. Additionally, I believe we should not be basing life-changing decisions on tools with at best moderate predictive accuracy. We should not accept and use forensic risk assessments that are not up to high standards without caution. We should recommend that these decisions should not rely upon risk assessments alone. Until more evidence arrives, we should inform clients of their uncertain usefulness, choose an assessment most suited to the offender and their crime, ensure we are competent in the tool, and be mindful of bias when determining risk judgments.